Welcome back to TV5 News at 9. Joining us this morning is board-certified neurosurgeon Dr. Jay Jaganathan. Thank you so much for being here, Doctor.
Morning, Colette. Thanks for having me.
Good morning. Of course, we're delighted to have you. Now, before we get into today's topic, we have some very exciting, some great news. Jaganathan Neurosurgery has obtained a Center of Excellence designation for spine by Blue Cross Blue Shield. Tell us about that, Doctor.
It's a designation that we just found out about a week ago that relates, I'm assuming, to a variety of factors, including volume, I'm sure related to patient outcomes and safety as well. I think it's a group effort by our entire team, including my colleague, Dr. Kramer, and my pain management colleague, Dr. Novak and Dr. Silverman, as well as the partner hospitals we work at. So we're very proud that we achieved that designation from Blue Cross, and we hope to continue to provide excellent service to the patients in the community.
We are so glad that you are in the community. Thank you for telling us about that. Congratulations to you.
Thank you.
You're welcome. Okay, doctor, let's talk about cervical radiculopathy. Now tell us, what is that? It's a very long word, very long terminology.
Yeah, so radiculopathy is a fancy term that just talks about irritation along the distribution of a nerve root. And as you know, the nerves basically start at the spinal cord and travel out to the arms and to the legs. And in a cervical radiculopathy, it's nerves that are irritated involving the neck. So classically, it involves pain or numbness or tingling that travels down the arms. But there can be a broad range of spectrums that can be manifested by it.
Now, doctor, what are the causes of cervical radiculopathy?
So that's a good question. There are a variety of causes. They range from disc herniations, which pinch the nerve. That's probably the most common thing that I see as a neurosurgeon, ranging from arthritis, where you have bone spurs that may pinch or injure the nerve as well. Less commonly, you can have injury to the nerves as they exit the spinal canal, from orthopedic injuries, from trauma, even from certain types of cancer. So it can be a variety of causes, but the most common causes are the nerves getting pinched right as they exit the spinal canal into the along the nerve roots, along the joints or along the disc space.
Now, some people are out there listening to this. What should they be looking out for? What are some of the symptoms?
So the symptoms can be run quite the spectrum. It can range from neck pain, arm pain, numbness, and tingling. In extremely severe cases, the spinal cord itself may get compressed, and that can cause more global symptoms such as problems with balance or coordination. In severe cases, they can even result in weakness in the arms if it's left untreated.
And how do you, doctor, diagnose a cervical radiculopathy? How do you diagnose that?
So MRI is usually the gold standard. It would tell us where the nerve is pinched, especially if it's pinched in the neck. It also shows the levels that are involved, which is important, particularly if you're considering surgery or steroid injections. EMG is also sometimes beneficial, especially in cases where there are multiple levels involved, because it can evaluate the function of the nerve, and it can tell you if there's any evidence of nerve damage that's present.
And what do people need to know about treatments available?
The treatments really run the gamut, and it's not always surgery for this. Most of the time, we start with physical therapy and pain management. Interventional steroid injections can help in many cases, in cases where that fails, there are a variety of surgical options that are there. It ranges from a fusion to disc replacement, which is a new technology that's becoming increasingly popular, and there are a number of minimally invasive options where we can go in and clean out around the nerve as well. That can be done without fusion.
Thank you so much, Dr. J. If anyone wants to learn more, where can they go to get some more information?
They can visit our website, mi-neurosurgery.com, or contact our office, 989-701-2538.
Thank you for joining us today. We appreciate it.
Thank you very much.
Of course, you're welcome. And you can find a link to all of this information in the hot link section of WNEM.com.